this is just a very, what do you say, uh, informal kind of a session which we're doing to get in touch with you guys. We are about 2 months away from the NEET SS exam 2025, second of this kind for this year. And we've already kind of stacked the app with so much of content and different types of content. And we have this folder called the High Yield Series folder, specifically designed for NEET SS. And we're planning to come up with a few more videos in that particular folder, which is an exclusively NEET SS folder. And as of now, that's basically the plan. So my aim in this particular Zoom session, this short Zoom session, is to specifically address students who are now going to give this exam seriously, which mostly includes the final year PGs and people who are just finished off with final year. So they are the ones who need to ask us queries with respect to the preparation, and they are the ones whom we are actually trying to address through this particular session. Uh, Queries relating to the residency stuff and all that, we have now coming up with a residency series pretty soon. So that residency series is going to be released somewhere in the towards the end of September. So that will be like exclusive residency content. So that will not be catered to in this particular discussion. We are just focusing on the NEET exam of 2025. So this current pattern NEET exam, we basically have had three exams now, and in fact four exams now, and all exams have actually looked into have had different patterns. So we can't exactly say as to how it would follow suit. But from whatever we know, we now got specific medical group, critical care group, oncology group. So the questions from the medical group are going to be centered around cardiology, neurology, nephrology, gastroenterology, and liver. Includes the non-oncology part of hematology, then rheumat, endocrine. So we have actually got seven chapters. There is no reason to study anything beyond these seven chapters. The rest of the basic science questions, infection questions, etc., are what you have to answer from your basic knowledge. It's not possible to study all the infections in the world and cater to that. So apart from that, questions on critical care, pulmo, onco, etc., are going to be very few or in fact zero as far as the exam is concerned. So if you study these seven chapters properly, I think you are in with a very serious chance. What people actually have a doubt with respect to is that Hudson 22nd, the 22nd edition has been released, and what are we going to do with that? So essentially, we have taught all these videos in 23, 24, etc., basically keeping the guidelines in mind. For example, a KDIGO guideline or the International Society of Cardiology guideline, something like that. So when Hudson comes, definitely go through the chapter, 100% go through the chapter, and if we find that there is something different from the previous edition and something which is interesting to discuss in the current edition chapter, we will definitely be doing that. So that is what I told us. A few add-on videos to the current list of high yield series videos will be now. We will keep on adding that till the exam. So that is what is currently the plan, and from there on, I take up more questions, etc., with respect to the exam. But I think the plan is pretty clear. If you have already watched the Harrison-based videos, that's pretty good. But I would always recommend you to watch the high yield series, because in the high yield series, everybody has catered to do the most essential part with respect to the exam. So try not missing the high yield series. That is the only thing. But Harrison videos already what have been done and what is there in the app are 21st edition based videos. But in that also, although it is named Harrison videos, I have not actually done it from Harrison. I've just tried to whatever I feel is most updated or best possible way is what I have tried to do it. So I think over to Nishanth and Baishyak to come up with their points as well before we take a few questions from the audience.
Baishak, would you like to go first?
Yeah, you start. Well,
So see, what happens is actually you're now in the see in the cusp of what I say now. When you're in MBBS, MD, and DM is like your ground floor is MBBS, your first floor is MD, and your second floor is DM. So what happens is when you're right now when you're pre PG you're in the first in the staircase between the ground floor and first floor. Right now you're in the staircase between the first floor and the second floor. So, each, you're all approximately in the ages of around 28 to 30 years of age. So, by now, you should have a particular pattern of study. The way you study is different for each and every individual. So, Right now, coming and telling that you should study 6 hours a day, you should focus on these all videos, you should revise twice before the exams. Again, that is pretty basic. So I don't think that should be required. So the most important thing is actually you should develop a concept of your strengths and weaknesses. For example, medicine is such a vast subject. You might not be strong in everything. So if you are say strong in something like cardio and nephro, say I was strong in cardio and nephro, those are the subjects you focus less on. You should focus on your weakest subjects. That's what I strongly encourage you to do. People keep on reading whatever they know. You should keep on reading your weakest subjects. So if endo and rheumata are your weakest subjects, please focus on that. Strategy is of utmost importance. So you know that. Just give me 1 second, Baishak. Could you just carry on? 1 second.
Yeah, yeah, sure. So, yeah, from one point I have to tell is that, like, see, you see the pattern of exams. You cannot predict what pattern is going to ask, but don't get panic in that, because if you see last year pattern, there are a lot of questions from the basic topics from the Harrisons, and some of the basic areas they asked. And actually, from neurology point of view, the questions even come from the pediatric neurology last time. So those questions can come, but that will be bouncers, and you cannot expect a particular pattern every time. So such questions, many times such questions, even though the question may look very difficult, but if you go through the options and go through the questions, many of these questions in the need pattern, especially in neurology, there will be some cue in the question which will help you to answer that. So even if you think that that is very tough question, it may not be tough. Your basic knowledge and the basic idea what you have learned from your 3 years of your MD will will going to help in that. And there will be some questions which comes from the need PG level that you cannot study. You whatever you know, that will be, because that is a very huge topic. You cannot go and study that right now. That you may be able to answer, that you have to take the luck. And then, yeah, then there will be some questions which will be very clinical lengthy questions in the previous years, but last time those questions were not there, so the pattern keep on changing. But altogether, whatever you have to go through is those which has highest yield, and like Nishant sir was telling, you have to go through your the areas you think you are weak from the major topics, because right now you don't have to study again and again the things you know, because you don't have much time, because especially when you are preparing for the first time. So you have to focus on those areas which you are weaker. And at the same time, don't get too much bothered about Harrison second, 22nd edition, 21st edition, 23rd edition, anything. Because nobody is going to put a question by opening the Harrison. The question will be collected from multiple persons. So it depends upon, if somebody is asking me to prepare a question, I will put questions from my own personal areas. It may be from Harrison, maybe from something else. See, Harrison is a collection of things from whatever guidelines or whatever whatever textbooks or articles the person who has written the textbook or the chapter has gone through, and particularly when he was preparing for it, the things that happened after that is also there. So it is not that everything will be coming from the Harrison, because I was seeing the comment section, everyone is asking about Harrison. See, Harrison is a good textbook, but it is not just about Harrison. It is like, this is a competitive exam, so you have to see the questions will keep on changing. If you see the previous last 3 or 4 years question, the pattern is keep on changing. There is no specific division, there is no specific pattern for exam, so you have to be ready to face that pattern. And I'll at the end, and you have to go through the high yield series. High yield series, especially neurocardio, the major subject, neurocardio, nephro, and the major subjects. You have to go through the high yield series, because high yield series will help you in NEET SS. That is actually made basically for NEET SS, because especially neuro, the major topic may be very vast. Because INSS in neuro, they ask very core questions. So you need to know a lot of basics of neurology. But for your NEET SS, high yield series is more than enough, is what I felt. And at the end of discussion, I may tell you like some of the areas which I think the questions may come from each topics. So, Nishant sir, you can continue.
So I think you should focus on your weakest areas. That should be your core focus of attention. Just don't keep on studying whatever you have learned. And I think you should strategize. So work on your MCQs. I think more MCQ, working up your MCQs is equally important. So that whenever you see an MCQ, if you notice that I've done a video on how to prepare for how to approach MCQs video, it's in the module. You should know that out of 100 questions, you will not know the answers. You will have not know the answers to at least 50 questions directly. Okay, you can infer an answer. If you're a very good student, you can infer an answer from the options in at least 20 to 25% of the time. So have a look at the options. Okay. Try to rule out one or two of the options. Don't just give up on that question. Because remember, even the best of students, 20 to 25% of questions, you have to infer the answer. It is where you am I audible?
Yeah, yeah.
Yeah, because where you in the how do you infer an answer for a question you don't know? That's what determines your exam. So everyone is going to answer the straightforward questions. Okay, so whenever you see a question, try to connect, try to rule out at least a couple of options, and then try to guess the best particular answer. Because attempting MCQs is an art. Okay, and that is what actually gets you through. I find MCQs to be actually the best format for the exam because even if the answer is in front of you, so you try to guess out the answer. That's very important for you. And remember, don't focus. You if you start medicine is such a vast subject, you can't focus on everything. So it's not like okay, I've not studied pulmonology or I've not studied medical genetics. Okay, remember it is not possible and it is even acceptable for you not to learn everything. Okay, it is too vast for you to learn. But and remember that 80% of output occurs from 20% of input, so that it is the what is important, what you must know what to study, what is important. That is why your high yield series comes in. That is why your previous question papers comes in. Okay, always have a look at the previous question papers, both. Even you can have a look at the INSS also, as well as the previous NEET SS question papers, and then you will know what are the important areas. So it is mandatory that you work up the MCQs as well as the previous question papers, as well as the uh, important, as well as the high yield series. So please work it up, and then I think you should get through with flying colors. So
Okay.
yeah.
Yogesh, just take the questions because we have a lot of questions, so we'll just try answering the questions.
Yes, yes, sir. Sir, I'll ask. So, from the questions that we have got, most of them are based on how to use the app, and the most questions we have got is watching only Harrison-based medicine videos enough?
See, actually speaking, we still now haven't had any specific residency content. I told you, we're coming up with residency content. So that's the reason why till now as we did not have any residency content, what you should be knowing primarily when you enter into a residency course is what the Harrison videos are. So they are basically kind of giving you a wholesome idea on the entire big ocean of medicine. So it is not centered for any particular exam or anything. If you want to get an idea on a topic, you can always watch that. You will get an idea of the topic, and there is no harm in watching that. The thing is that when you're looking for NEET SS specifically, you can always after that go and watch the high yield series. The high yield series videos are specifically catered for NEET SS. So in that you can see the individual faculty talking about the different permutation combinations, etc. Now that we have different umbrellas for each of these oncology, critical care, etc., I recommend you to specifically watch these 7 chapters: cardio, neuro, nephro, endocrine, gastro and liver, rheumatology, endocrinology, and sorry, rheumatology and hematology. So this is what you need to be watching. The other chapters, even if you skip, I think would be okay now because we don't get questions from the other subject headings, and we are basically going to get far and few questions on infectious diseases and basic sciences, which based on your primary knowledge you'll be able to answer. So or sometimes not able to. So that doesn't really matter. So I don't think there is anything like that. High yield series is more than enough for this particular thing. And I don't think there should be too much of discussions on the same. And going and specifically doing tables from Harrison or basically figures and diagrams from Harrison is not required. We will do a chapter review. That means 22nd edition nephrology. I'll do a chapter review. My high yield series is 21st edition nephrology Harrison chapter review. You can see each of the topics being discussed with my comments on what has been written in that book. So some of the chapters I'm okay with, some of the chapters I'm not okay with. So I have actually openly expressed my views on the same. So the same thing we will do with the 22nd edition also. But remember, more than mugging up the textbook, it's about whether you have a concrete idea of the topic. If you have a concrete idea, as Nishanth said, you can rule out and come to the answer. You don't have to mug up everything. And nobody can be perfect at answering all these things. Hope that caters to it, because this is not like a +2 class or after 12th kind of entrance preparation thing where we have to go and explain everything in detail. I think, as he said, you're all very, very grown up people. So I think that this is how I think it has to be taken. Any more questions?
Yes, some questions like biostats and genetics, how much weightage do they have? So this is one of the.
See, I told you, we had an exam in 22, 23, and now early 25. If you look at the 25 exam, we had only three questions from biostatistics, and all the three questions, like if you have done your thesis, I think that's more than it's on median and mode and standard deviation and all that. 23 paper had few more questions on biostatistics. That's the reason why we added it in the app. But I think even if you skip and go, no problem. Medical genetics is also like questions on autosomal dominant, autosomal recessive, and that. For that to study the whole thing is not possible. If you know, you know. I don't think any specific preparation for all that is required.
Oh,
Yes.
yes, sir. Some questions like they were asked important aspects in cardio neuro, important topics. So I think for that, IELTS is what you
Yeah,
suggest.
I think Nishant can answer that. Yeah.
For cardio, see, they can ask you, firstly, you must accept that they can ask you whatever they feel like. But your important aspects in cardio are always heart failure, coronary artery disease, and they'll ask you questions from ECG and clinical cardiology and valvular heart diseases. So don't expect questions from congenital heart diseases. I've seen somebody asking on ICDs, pacemakers, and CRTs. I think those will mainly be asked in your INSS. So if you're preparing a paper for your NEET SS where you expect a lower standard, concentrate more on clinical cardiology and valvular heart disease that would have already prepared for your exams. Heart failure, coronary artery disease, ECGs, and ECGs and clinical cardiology. I think those should be sufficient.
Yeah, from neurology, actually the high yield topics I had covered, but I'll just go through the which are at least particularly which are topics in each areas which has been asked previously and those you might have to know. Only some topics like if you come to the first part of our module, which is I discussed about approaches and all. In that there has been question asked on apraxia, and there has been question asked on aphasia. Then embryology topic, you can if you want you can write also. Embryology topic actually last time they have asked lissencephaly and I think porencephaly or something like that. But that question I don't think it will repeat again. If that is just a like that's just a bouncer, I don't think they will ask again. So that was the two questions, but we have discussed it in the module also. But we can leave that. From the sleep part in narcolepsy, and maybe RBDs and some parasomnia. Just know the name and drug. That is more than enough in that area. And if you want me to if you want to read one topic or go through one topic in SS, I'll suggest you to go through the treatment of stroke, acute stroke management, and maybe endovascular therapy. That two topics might help you because many times they may ask questions from acute stroke management, wake up stroke management, all those things they have been asking. But I mean, I'm not sure because every time, sometimes they will not ask much questions on neuro. Last time it happened. Then from the muscle, inflammatory myopathy is one topic, expression antibodies in inflammatory myopathies. That is one of the favorite topic. Then LGMD, the genetics, that may ask, but not have been. But inflammatory myopathy is the most important topic. Then about the dementias, Alzheimer's, DLB, then NPH, and also you read about IAH. These has been IAH has been repeatedly one question has been coming in almost every exam. Then from Parkinson disease and this one, drugs of PD, especially side effects, adverse effects of drugs. Then atypical Parkinsonism, they may give a clinical scenario. There's recurrent falls and rigidity, truncal attack, truncal rigidity. That will help you to find out that is PSP. Like that, they have asked a clinical question from the atypical Parkinson's. Then again, atypical you have to read particular DLB and PSP. And from the hyperkinetic movement disorder, chorea syndromes, particularly Huntington's, chorea acanthocytosis, McLeod's. This has been previously asked questions. Then DVTs, like the genetic dystonias, they may ask but not ask still now because it is a one-liner question. Usually now one-liners are not that common. Stroke and brainstem syndrome is one area, especially acute stroke management and brainstem syndromes that you have to go through. But I have discussed the crux of that again in the high yield series. If you want to read only the high yield, you can read high yield also. But these are the headings I'm telling. Like these are the questions asked. Then from the headaches, especially migraine, the drugs, newer drugs, and the trigeminal autonomic cephalalgias. Then MS again, the favorite area is the side effects of drugs, adverse effects of drugs. And NMMO, they have asked about the clinical scenario where they had shown a long segment involvement or an optic nerve involvement. That questions has been come. Ataxia, always CA and autosomal recessive ataxias. At least know the genetics of that. No need to read the entire thing. At least know the genetics of these things. Then meningitis is one favorite area of question where they ask about some CSF findings, or they may give you a tuberculoma, or they may give a picture of meningeal enhancement that has been asked previously. Then neurosis cirrhosis and tuberculoma difference that also I discussed in the high yield series. If you go to high yield series, it is there. Almost all those things I've been telling here is there in the high yield series. And about the motor neuron disease, again, the newer drugs in SMA, at least know the name of the drugs. Then ALS criteria. Then EEG, they had been asking very basics. How many leads you have to place? What is the speed of EEG that has been taken? And how much leads is minimum for a death declaration? These things also are discussed in the high yield series, not in the main module. High yield series in the miscellaneous part it is there. Then myasthenia gravis, again the investigation part, the antibodies, which are the antibodies, and what about RNS, and again adverse effect of the immunosuppressant. That is common question like MMF, acetylprimandol. These much topics is the important things, and these had been covered. Actually, whatever needed is there in the high yield series. But if somebody asks in the question that which all videos I want you to watch from the SS, right now SS videos it is difficult to watch, and if you want to watch acute stroke management and endovascular therapy.
So I think
Okay.
you should not mix and match. So there are people asking questions on,
I
I have my exam next month, your MD exams next month. How
No,
do
we
I
are not
prepare for
catering to that.
IN?
No, no,
Yeah,
no.
how
We
do
are
I?
just catering to yeah, no, we are just catering to the exam INA. Sorry, NEET as exam
Yeah,
2025.
yeah, just one second. Yeah,
Yeah.
those should not be asked right now. Focus on your
Yeah.
MD exams. And
Correct.
INSS, I think you focus on later. This is purely a NEET SS approach. All these
Definitely.
approaches are going to be different for all three exams.
Okay. So again, many of you are asking us to where do we get the previous year's questions? We have done extensive recalls. You can see it on YouTube. 2022 exam, 23 exam, and 25 exam. We have already done the recalls, so you can go back and see the questions, and you'll understand that there is no specific pattern. Three exams have been very, very different. As far as nephrology goes, I think I've highlighted this in the first video of the high yield series. Basic sciences, we have urine analysis being asked, vascular diseases, renal artery stenosis, tubular interstitial renal tubular acidosis, and autosomal dominant polycystic kidney disease, glomerular diseases, nephrotic syndrome, membranous nephropathy, RPGN, potassium metabolism, hypo and hyperkalemia. Then ABG question mandatory, and a diabetic kidney disease question management mandatory. This is what they have asked so far. I don't think they are likely to ask anything more apart from this, and this is what we have done. Rheumatology, connective tissue diseases, basically a clinical question on SLE, a clinical question on inflammatory muscle diseases. You were saying it's a neurology rheumatology overlap, antibodies in scleroderma, sarcoidosis, anything and everything from sarcoidosis. Then rheumatoid arthritis, clinical features based question, spondyloarthritis, special focus on psoriatic arthritis. Then giant cell arthritis, Takayasu comparison, Goodpaster's disease, which is again nephrorheumat. Then your Wegener's versus that is what. So apart from this, again, nothing has been asked. So this is what actually we have tried to cater to. And even in endocrine, the crux has been always on adrenal and bone mineral metabolism. In adrenal, everything starting from Addison, Cons, PO, Men syndromes, Meon syndromes, PGA, congenital hyperplasia, everything about adrenal gland is so very, very important. Pituitary only prolactinoma, acromegaly, SIADH, diabetes insipidus. This is the core. And metabolism, everything about calcium. Calcium, hyper, hypo, causes, workup, ECG changes, everything very, 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 very important. And osteoporosis. Osteoporosis is also mandatory question on management of osteoporosis. All the new drugs for osteoporosis, the side effects of those drugs, bisphosphonates, everything about bisphosphonates, all that is what they have actually tried to focus. And hematology, I told you last year, because oncology has branched out, they did not ask anything from the hemato-oncology side. Whatever they asked in hematology was the core hematology, which includes anemia, workup, hemolysis, megaloblastic anemia, iron deficiency anemia, aplastic anemia, myeloproliferative disorders. So everything the non-oncology side, that is what they focused on. So this is essentially, we have repeated this, we have told this number of times. I have done a module in the beginning of this year, again highlighting on what has been asked with respect to the exams. But again, let me tell you, there is no strict pattern. So don't go for patterns. We have had only three exams, but we've not been able to draw any pattern out of those exams. And as Baishyak said, please don't sit and lay eggs on top of Harrison. It is not required. 22nd edition chapter review we will do, but don't ever think that that is the ultimate book for this exam. They have never stuck to any plan like that in the history of this exam that is spanning across 22, 23, and now this 25 exam part one. So that is how it has been. We'll take few more questions. Yogesh?
Yes, sir. So I
Yeah.
think everybody's asking. There is only 2 months. Will that be enough? That is something that they've asked.
We are doing this module today, so I cannot go forward or go behind. So we have only 2 months. I think that's more than enough. It's not the kind of exam that used to happen 10 years ago, where you have very few seats and people are like kind of fighting out for the seats. You have ample number of seats. You are basically having to make this big decision of which course I want to do and how I want to do and all that. There is definitely enough time. It's more than enough time. You watch through the high yield series and some of the basic medicine videos. I think you should be more than okay to actually get through this exam. There is no extra preparation as such required. If you have done your PG reasonably well and you have initially good grounding of these subject in these subjects, I think it should be a cakewalk, I guess.
See, remember that you have already you have already written an MD exam. You have already gone through your books. You already have a baseline. It's not that you're starting from scratch. Okay, so even 2 months, all that you need to do is strategize and utilize the time wisely, because you have already read most of the subjects. You've already prepared for an exam, your MD exam. Although it is a bit different, but the basic subject is still the same. So I think you
Yeah.
just need to strategize, and it's not like you are undergraduate exam or something. It's not like you are already have read the book, so I don't think it should be a problem. See, please understand, 2 months is more than enough.
100%. It's more than enough.
Yeah, and when I was telling the topics, I forgot to mention few topics. One is peripheral nerve. Peripheral nerve, most questions came was from like which among the following is sensory, pure motor, pure sensory. Those questions come in the approach part. Then GBS. These two are the most important topics in peripheral nerve. Then about epilepsy, status epilepticus, and they may even keep some EEGs. Usually, hips arrhythmia is a common that you know. Then again, they can show a spike and wave discharge. These two things has been asked many times. These are the two other areas. Then somebody asked about the autoimmune encephalitis. It is actually in that NEET-based MCQ. There are some videos which I kept in the NEET-based MCQ because those are very many things which are there is not much need to explain because those are just you have to study it like mugging up. So just try to make it as a question and answer thing. In that there is a video on autoimmune encephalitis. Actually, it covers fairly enough almost every topics in autoimmune encephalitis. It is there, except maybe that new few autoimmune antibodies like Clutch one and all that which came last year. Other things are actually covered in that.
Yes. So, one question, like people who are not from general medicine and they are appearing for the exam for subjects like infectious disease, medical genetics, and these people are from MD, micro, patho, these kind of backgrounds. So they are
They'll
asking.
have to watch the Harrison medicine videos, basic medicine videos of all the chapters to get an acquaintance of how this thing works, because they may not have seen these cases and may not have their own understanding. So for them to get baseline understanding, I think chapter by chapter Harrison based videos is mandatory, at least for these 7 chapters. That is
For them,
cardio.
there is no shortcuts actually.
There's no
For them, I
shortcut
don't
on
think
that.
you can. For them, I don't think you can offer a shortcut. They have to
Yeah, yeah.
actually go
It's
through the
even more.
subject,
Because they
because
can't
when you're
reason out
yeah.
and yeah, they cannot eliminate. It's like me writing a pediatric exam. So only what I know, I know. I cannot logically decipher things sitting for a pediatric exam because I have not seen. The same rule applies there. They have to study.
Somebody
When you've dealt with a case, for example, you've seen a GBS case, you've not read anything on GBS. If you see 4 or 5 GBS cases, you know what GBS is.
What it is,
So when you
yes.
don't have that back, you're not building on a solid fundamental. So you have to take time and then watch the entire
Yes,
video and build your
correct,
fundamentals.
correct.
yeah,
Yeah, question
somebody
bank again, cover to cover, we don't have to do the question bank. Okay, I don't think that is required. We do question bank for practice. So you can do question bank as a practice and do grant tests. I mean, as and when you study a little bit, maybe 4 or 5 days, once in 4 or 5 days, if you can take a grant test, I think that will be great. I don't think you have to do the question bank cover to cover,
yeah,
especially
somebody asked about oncology also.
Oncology will have a
oncology
different webinar, sir.
separate session.
Yeah.
Yeah, yeah.
See,
And sir,
there is a
repeatedly,
certain point. Yeah, there is a certain point where you get saturated doing MCQs. See,
Yeah.
please understand what is mandatory is your previous year's question papers. That is mandatory, and you do a certain amount of MCQs to get familiarized to that particular format. It should not be that you take every topic. I'll see 10 MCQs, 15 MCQs. It doesn't work that way. Okay, so I think you should attempt a lot of MCQs to familiarize yourself with the pattern. But just looking at MCQs doesn't make sense. There is a certain point of saturation for that. You
Yeah.
need to
Yes.
make your subject strong rather than, reading only the
Exactly.
MCQs.
Yeah. See, like,
INA exam has a pattern. NEET exam does not have a pattern. If you carefully observe INA exam, at least some pattern you can draw, and you get an idea. Okay, this is more likely to come, etc. But NEET SS exam, unfortunately, we haven't had any pattern so far. So you look at these exams that have happened; they've all been considerably different. As Baishyak said, some exam has had neurology questions of extraordinarily high difficulty level. One paper they actually neglected neurology, so there is no pattern. So you just can study the way you can. And they may ask you some pediatric neurology question. How will you answer that? There's no way you can answer that. But just remember it's same for everyone. So don't get too bothered about it. You just go
yeah.
with the flow and study what is more important. And I think that should be enough. Because all the toppers we've interviewed after the exam in the past 2 3 years have all given the exam alongside with their final year. There have been only very few people who have actually taken a break and done all that. So, yeah, most of the people have given the exam in the first attempt, few people second attempt. So we haven't seen so many people who have like wasted years, and then I'm not saying wasting, but at least not spend so many years after their course for super specialty C. That's not common to see now. It is common during our times, but it's not common to see now.
I think,
Yeah.
once you finish your exam, you will realize that, most of the questions are based on your long-term knowledge, not what you have studied about 1 to 2 weeks before your exam.
Correct.
So you will be answering some question based on some case
Yeah.
you have seen in second year MD, or some page or website which you have watched, which you have seen in first year MD. It will be like that. It's not as if whatever you have crammed in the last 1 month, and that's going to, be responsible for most of your marks.
Yeah, that, like, when you're reading the MCQs, like, MCQ will help you in two ways. One is like, you will know to understand that how to go with the question pattern and how that things click. The another way is like, see, when you are once you are reading the theory part or something, some area you're watching, suddenly you are reading an MCQ question that actually, if you talk in terms of the way of how you remember things, that actually triggers another pathway of memory. That is sudden surprise to the brain when you see a question which is out of the box. That sudden surprise will increase your attention, and that will is another way to learn. You can back revision from the MCQ. Like when you when you see a question, that area, if suddenly if you're not remember, you can go and back revise from the area which you have studied previously. That will help you to memorize it much better. That was the way I did when I was doing my MCQs.
Yes, sir. Sir, immunology is one thing they're repeatedly asking. So the topics in immunology.
Immunology, last time and all, yeah, we got only one or two questions, and those were on primary immunodeficiencies. Any one immunodeficiency, common variable immunodeficiency or hyper IgM syndrome, any one immunodeficiency, they can ask you one or two questions. There are three places where I have done it. One is immunology concise under RUMAT, we have done it. Then I have done a specific section on primary immunodeficiencies under RUMAT, the detailed one. And then we have under this, what do you say, based session also we have done this. So 2 3 places I have done it. If you have time, you can watch everything. But I think immunology concise is more than enough. In that, I think in 2 or 3 hours, I have tried to go through the main points. Even if you don't study immunology, also no problem. Maybe that one or two questions which come, you may be knowing otherwise as well.
Yes, sir. I think those are largely broadly the questions. Some other questions like
Talk about like how many GTs you are going to add and how many are currently there, and those questions are also coming.
yes, sir. Those the schedule is already there on the app, sir. Until the exam, every month we have a GT for every group, and we would also suggest we have started the GTs from the end of last exam, so you can go and attempt the previous GTs. So I think there will be adequate number for all the groups.
Okay. Then there's a question on, is it okay to drop pulmo, onco, and critical care if aiming for medical group? Yeah, it's okay to drop. Only one or two questions might come and that you may be able to answer otherwise with your knowledge. So that's it. Then I got 1,700 rank and joined DM cardio at a government setup, but unable to adjust to the setup. Planning to leave and prepare again. Confused. Nishanth.
See, it depends on what government setup is and what you want. Okay. See, if you have studied in somewhere like Calicut Medical College, it's a very good center. That's also a government setup. So that what I'll do is I'll ask them to send you my number. You
Yeah,
just
exactly.
phone me. That will be
Yeah,
better.
yeah, that is better. Then, so any more questions, Yogesh?
So no, sir. These are broadly the questions. I think we have almost answered. Q bank tests and what we
Yeah.
want, how to prepare everything.
Please
So
ask faculty to throw light as to how to divide time for systems and plan tests and revision in these 2 months for freshers. That's what I'm trying to tell you, man. You just grow up a little bit more. You make your own plan. I don't have to actually give you any plan, and there is no set plan or set system like that. You can watch the videos and you can actually divide the time and do things. And you know that high yield series you have to finish, and high yield series portals what you have to focus on. Rest the time division and all. This is not the place. Right? You can do it yourself. I mean, I don't have to actually advise you. And one more question, respiratory medicine consultant wanting to attempt DM cardiology. I've gone through the five series videos, but still finding it difficult to crack MCQs. Any tips for proceeding with preparation?
No, if it's for the NEET SS, I think you have to, read proper medicine. You have to look at the Harrison-based modules, read proper medicine. If you are looking at the NEET SS for the cracking the exams, because
Okay.
pulmonology said all said and done, although it is part of medicine, there are a lot of questions which there's a lot of areas where you are not focused in. For example, neurology, okay, nephrology, all those don't come under when you're doing your pulmonology. So I don't think you can skip all the medicine videos. You have to look at all the Harrison based videos and then attempt the exam if you're planning for the NEET SS.
Yeah, right. University exam, a lot of questions have come, but what I'm saying is university exam, you like don't bring it up here, but even then, give your university exams the best, and with that knowledge coupled with the high yield series, I think you should be able to get through NEET as exam. I don't think there should be any problem whatsoever.
I think your
Bashir,
first focus should be on cracking the university exam.
yeah,
Pass your
Bashir,
MD first, then look at DM.
yeah. Doing neurology from AIMS Delhi versus PJ versus top institute via NEET SS. Does it make a difference?
Yeah, that like first of all, you want to decide what sort of thing you want first. Because for me, if you ask me, I have a lot of preferences, not just career. I have to take care of other things, family also. So you have to think of everything and you have to decide what you want first. Whether you want to be very career oriented, whether you want to go to any higher studies, to want to do go to some postdoctoral fellowships outside India. If you want to do something like that, go to institute. You always have that opportunity to exposure on this postdoctoral fellowship, and so you can go and get a degree from outside India and then come back and practice in some place. So first of all, your idea should be where you are going to practice after completing your DM. If you are going to practice in a place with a second tier or third tier city, it doesn't needs whether you are doing your DM from AIMS or from wherever you are done. That doesn't matter when you come to practice. Nobody is going to look at your name board and ask what was your rank in NEET SS and what was your rank in INSS and where did you study. Patient will come to you once you start practicing it. Totally be different based on not based on your rank and where you're studied. So it is your preference that what you want to be. If you want to become one among the super specialist to do a postdoctoral fellowship from a reputed place, then you go with institutes. Otherwise, if you want to practice in third tier cities or in a rural areas, no need to take AIMS or those central
So
institutes.
one thing I would like to add is whether you study from AIMS or whether you study from PJ or whether you study from a private medical college, it really matters only for your first job.
Yeah.
Okay, from your second job, if the person who's hiring you will call up the person in the first job and ask how were you. So it really actually matters for your first job. It opens door only for that. So
Yeah.
you might have studied in AIMS or PGI, but if they say that you are a highly scratchy fellow, you don't work well in a team, patients are angry with you, then it automatically doesn't matter from where you studied. So all this opens doors only for your first job. And then it's after that your reputation carries you through. How you behave in your first job.
Yes. Then there are questions on will the exam be postponed and all that. So that's
That is
not the
beyond
thing.
us.
That's not. Yeah, way beyond us. Then there is a question on I give join DependB cardiology but want to upgrade to DM in your suggestions.
It depends on where you study your DNB cardiology.
Yeah. I think those people can actually directly contact us. I think that would be better because it's not possible to answer all that. Um, Then how many questions should I attempt? That's again purely a personal call,
Maximum.
but I would attempt all the 150 questions. I am a person who attempts everything. But maybe if there's a question completely ambiguous, you can leave, but I don't recommend leaving more than 5 questions. What do you think?
All toppers, all toppers consistently attempt more than around 95% of questions
Yeah,
at least.
more than 95,
Like,
correct.
because even if you will automatically get a few questions wrong. The questions you think are going to be correct also you'll get it wrong. So so aim for at least more than 95% of questions.
Update videos on new edition of Harrison. Don't call it update videos. That would make or give a feeling that the one that we have done is not updated. So we'll do a chapter review. That means I'll do a chapter review. Nephrology, how the new current edition chapter is, what is its difference. Immunology, again and again, you are asking, please go and see the app. We have concise immunology and also we have immunology videos. So whichever is comfortable for you, you can watch that. Division of time among general medicine MCQs and SS MCQs. These are all very tough questions. I myself have not divided any time and done anything like that. So, if anybody wants to take, if Nishan, you want to take that question, how to divide time among MCQs and your theory preparation?
I think your first focus should be on theory. Okay,
Yeah,
MCQs you can practice as an added, to get familiarize yourself with the subject. That's it. It should not
yeah,
be your primary more focus of preparation. So if you know your subject, you'll automatically answer your MCQs. They're not going to ask you direct repeat MCQs. I think you're beyond that level. They're not going to ask you, one word questions or something like that. So you can forget about that. So your subject knowledge should be strong. That is the
yeah,
first thing you should focus on. Attempt MCQs to one, familiarize yourself with the format, and two, to get a hold of the previous questions. Beyond that, I
exactly.
think it's not
Not
nothing like
required.
a NEET SS or INSS MCQs.
Yes. And then working as an SR in a college, they are not giving leave. Dilemma is to leave the job and study or to study along with work. I mean, it's up to you. 2 months means it's better to take leave and study, I think. And no way that like last 2 months, if you try to work and study, it may not work.
See,
Okay,
practically
okay.
speaking, very few people have
Yeah.
worked in a high volume center and cracked the exam. It's not
Yeah,
impossible, but very few people have.
definitely. Yes.
Okay. Yes, sir. I think we
Yeah.
can conclude. We are getting many more, but I think we've broadly answered everything, sir.
Yeah.
They can give my number to those who have asked. They can
Yeah, exactly. And any more things specifically they want to know, of course they can. And I mean, we'll be having separate sessions for oncology, critical care, all that we'll be having separate sessions. So don't worry about that pulmonology. So you can ask your questions there. And best wishes and just carry on the work that you're doing, and we'll try to add the chapter reviews into the high yield series and just watch the high yield series properly. Wherever you feel that you want more grip on the subject, you can go back to the Harrison videos to get the base right. You want more advanced things and you want to get on with the subject, you can always go to the INI videos of each of the chapters. So all the options are there with you. And this month then residency videos are also going to be released. I think these are too many things on a platter. I mean, it's like you can even do MD sitting at home. So theory part, you don't have to focus too much, be worried too much on. Everything is there for you. Just have to find time, watch the video, and learn. And I think that learning part is very, very much fun. So just enjoy the process. I think that's more important.
Yes, sir. Thank you, sir. Thank you, Baishak, sir. Thank you, Nishan, sir.
Yeah.
Okay. Bye.